I'm Annette Logan Parker, and I'm the founder and CEO of Cure for the Kids Foundation. Thank you for joining us today. I'm honored to speak to you on behalf of the importance of the HOPE Act of 2023, and I'm very excited and grateful that you're all here with us today. Some issues, like the challenge of providing medical care for undocumented immigrants, have been with us for so long that we end up adapting to them as seemingly inevitable chronic conditions of our healthcare system. People become desensitized to yet another report on the consequences of not providing medical care for undocumented immigrants, consequences that go unnoticed by many, and it is often just far too easy to ignore them. Here at Cure for the Kids Foundation, it's impossible for us to ignore these consequences. Among our hundreds of children in active treatment for childhood cancer, we currently have 10 who hold the undesirable status of being undocumented and who also have an undeniable diagnosis of cancer. Childhood cancer does not care about immigration status. It does not select its victims based on healthcare coverage, nor does it retreat or give up simply because a child's family has no way to fight back. The challenge of providing medical care for undocumented children is such a long-standing issue in our country that many of us have become cynical about yet another set of recommendations and another debate about what to do. This cycle must be broken, as it was with education. In the 1982 landmark U.S. Supreme Court case, Plyer versus Doe, it was ruled that undocumented children are entitled to the same kindergarten through 12th grade educational opportunities as provided to students whose citizens are legal residents. In addition to public education, the case also granted students access to free and reduced meals, special education services, and school-sponsored events and activities. This ruling was based on the reasoning that undocumented children are illegally in the United States through no fault of their own. Shouldn't the same reasoning be applied to children with cancer, children who need life-saving medical intervention? Undocumented children with cancer are being denied Medicaid coverage by virtue of the illegal acts of their parents. The lack of available health insurance coverage for undocumented immigrants, particularly children, should not be an acceptable chronic condition of our healthcare system. It is in fact treatable, and it is indeed preventable. The debate about whether to and how to address this topic should, at a minimum, recognize that our existing healthcare policies and the piecemeal remedies currently in place hurt the children of Nevada and the healthcare delivery system itself, which in turn hurts our state. Now, we all know there are many reasons why this topic is complicated and difficult to resolve, with legitimate competing arguments from both political and economic perspectives. However, the one argument that we at Cure for the Kids Foundation feel has no place whatsoever in a legitimate debate about this subject is that the lack of coverage for undocumented children with cancer doesn't matter. It does matter. It matters to the children, and it matters to the healthcare professionals who care for them. These children may be undocumented, but they are still deserving of a chance at life. Cure for the Kids Foundation, we are the professionals who diagnose and treat children with cancer, and we are obligated by the virtue of our profession to provide care and treatment to these children, regardless of their status of being undocumented and consequently uninsured. We genuinely have no choice in the matter. We are just not capable of looking these children and their families in the eye and telling them they have no option but to go home and let cancer win. Our commitment and dedication to the profession of fighting childhood cancer simply does not allow us to concede to our rival without a fight. Expecting us to only fight for some children and knowingly let other children, based on their immigration status, simply wither away with cancer would break our hearts and eventually cripple our capacity to keep fighting at all. Nevada's current policy that excludes undocumented children with cancer from being eligible for Medicaid coverage is in direct opposition to the state's publicly declared interest in the health and welfare of the children of Nevada. The undocumented children of Nevada are illegally in the United States through no fault of their own. We provide them with an education based on this logic. It would also make sense to apply the same principle when they are diagnosed with cancer. After all, they also have cancer through no fault of their own. Now, this is a very important point that I'm about to make. The life-saving treatment required to fight childhood cancer is not considered an emergency service. The medical intervention these children need is not covered by the Emergency Medical Treatment and Active Labor Act. Hospitals are not required to provide cancer treatment services, not even to children. It is not a covered benefit under emergency Medicaid. And the current structure of emergency Medicaid completely excludes the outpatient environment, leaving absolutely no access to care for undocumented children with cancer. Therefore, the burden of childhood cancer treatment for undocumented children falls exclusively on the outpatient oncology team, which in Southern Nevada is Cure for the Kids Foundation. Hospitals are only legally required to provide emergency services for undocumented children with cancer when they are actively dying and the fight has been lost. Providing coverage for these undocumented children with cancer, whose families would be required to meet all other requirements established for Medicaid approval, is a reasonable solution to this long-standing problem. The HOPE Act of 2023 matters, and in the case of childhood cancer, so does the age cap for eligibility. Childhood cancer does not simply turn into adult cancer because a patient turned 18 years old. Fighting cancer can take many years, and the child will often need treatment and subsequently coverage extended into young adulthood so that we can finish the fight completely. We at Cure for the Kids Foundation urge you to support the HOPE Act of 2023. Denying children with cancer access to Medicaid solely because their parents came to our country illegally is not only cruel, but also unnecessary. In my opinion, systematically denying children with cancer, children whose lives can be saved, access to medical care through an established state policy exclusively based on immigration status, contradicts our country's fundamental value of providing equal opportunity for all. Thank you. I'd like to now introduce Clark County Commissioner Tick Segerblum to the podium.
Thank you so much, Annette. I'll be real brief, but I'm a Clark County Commissioner. In my role as a commissioner, I'm also the vice chair of the University Medical Center. I've learned today that UMC does not treat childhood cancer. In fact, all the childhood oncologists in the whole state work for you. So this is so important, why we're here, this great institution. But let's just face it, the reality is, how can a society as rich as our society distinguish between this child who's 6 or 7 or 8 or 9 and this child who's 6 or 7, 8 or 9 because of their status? That is unacceptable in the 21st century. That is unacceptable to me. And thank you for Senator Donati for proposing this to make sure that we all get care. The status should not be an issue. We are a society that is wealthy enough and accomplished enough that we can treat children based upon their need and not based upon their status. So I can't thank you enough, Annette, for what you do out here, and Senator Donati for sponsoring this bill. And please, let's all push, make sure that this thing gets to the legislature, and then make sure that the governor signs the bill. Thank you so much.
Thank you. Thank you, Commissioner Segerblum. Now, I would like to invite Catherine Salkanovich to the podium. Catherine is our Director of Patient Experience, and she's going to share with you a Cure for the Kids patient story. Kat?
Thank you, Annette. I'm here today to share a story with you about an 11-year-old boy who was once a vibrant and athletic child who dreamt of being a soccer player. However, his childhood was taken away by cancer, and he is now disabled. His medical journey started in 2022, just last year, when he had a mass removed from his left leg. This young boy was not only uninsured, but also undocumented. So after the initial mass resection at UMC, he was sent home with little to no follow-up. His mother knew something was very wrong later that year when the pain from the original surgery did not go away. After months of unresolved pain, this boy became a patient right here at Cure for the Kids Foundation. It was quickly confirmed that the pain he was experiencing, it was caused by a new mass on the same leg, and he was now diagnosed with a very aggressive type of bone cancer. Fortunately, the mission of Cure for the Kids Foundation allowed chemotherapy to be started immediately. Yet the cancer was extremely aggressive. Chemotherapy alone was not going to be enough. We were not able to save his leg, so he is now in the hospital, and he got his leg amputated from the hip down. As an undocumented young boy, he already understands the impact and the burden of healthcare disparities in our state. He knows his mother cannot afford the very expensive medications prescribed for pain management, so he's left to suffer. He knows that without Cure for the Kids Foundation, he would not be receiving the life-saving chemotherapy he needs to live. He also knows that his mother cannot afford a wheelchair that is properly fitted for his size, yet he's still grateful for the oversized wheelchair that we were able to get donated for him. This young boy understands that because he was not born in the United States and he holds the undesirable status of undocumented, that he will never be treated by an occupational therapist. He will not have access to new and appropriate durable medical equipment, and he's not likely to receive the ongoing behavioral therapy intervention that he requires for a child that now is missing a limb. The importance of the HOPE Act of 2023 cannot be understated. For all the undocumented children of Nevada, being undocumented should not be a childhood problem. Children do not decide where they live, and certainly cannot control whether or not they get cancer. Please support the HOPE Act and ensure that all children that live in Nevada have access to the life-saving care they need when they need it. Next, I would like to invite Nereida Bobadilla to give us a perspective from a patient. Thank you.
Good morning, everyone. My name is Nereida Bobadilla, and I am truly honored to be here with you today. As a proud member of Make the Road Nevada and an undocumented immigrant, I want to share my story with all of you. When I was 3, my parents decided to navigate uncertainty and migrate to the United States, propelled by a better hope for life. However, life here has been a test of endurance. While my siblings, now citizens, enjoy healthcare whenever they need it, I have to endure pain and discomfort for days, afraid to burden my family with the cost of medical care. It is not easy to even It is not easy to face even minor health issues when you don't have the means to seek proper treatment. I often think about the tremendous burden that serious illnesses like cancer place on children. It breaks my heart to consider the harsh reality they face. Cancer is the leading cause of death for children under 18, and the thought of what they go through is unimaginable. Yet, there is a glimmer of hope. The HOPE Act, or SB419, promises a future where life-saving treatments are accessible to all children. Regardless of their status or financial means, this act is a lifeline for our future, our children. Today I stand before you as a young 18-year-old woman who calls Nevada home, advocating for a dignified life, a future where every child, regardless of status, can grow up healthy, free from the shadows of inaccessible health care. It is our moral duty to ensure that no life is deemed too costly to save. Let's unite as an empathetic community to pass the HOPE Act. It is not just an act. It is our commitment to a dream, a reality we all deserve. Thank you.